Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, after diagnosis of gastric ulcer, what are the complications of gastric ulcer is important. The most common complication of gastric ulcer is perforation. Because the ulcer is mainly present in the lesser curvature of the stomach, it perforates into the lesser sac mainly. Most common complication of gastric ulcer is the perforation into the lesser curvature. Now, there is because of the gastric ulcer, there is something called as hourglass contracture, which is mainly seen in the women exclusively, and this occurs due to the cicatricial contracture of the lesser curvature. When this curvature becomes contracted like this will give an appearance of a hourglass. Here it is contracted here, so this will be something like this. So hourglass is like this, right? Constriction. So this is looking like a hourglass. Okay, so hourglass contracture is seen due to the contracture in the lesser curvature. The next type of contracture is teapot stomach or handbag stomach. When there is cicatrization or shortening of the lesser curvature, this will result in teapot stomach. So actually this is the lesser curvature. Here there is an ulcer. Now this is shortened. So like this it is shortened. When this is shortened, then there is a teapot. It is something like teapot or handbag stomach is seen, because this lesser curvature is shortened and this looks like a teapot or handbag stomach, which is a complication. Sometimes the gastric ulcers can also undergo malignant transformation, though rare, but malignant transformation of gastric ulcers are common, can occur. So these are the different complications of gastric ulcer.
thank you and thank you for watching.